Gauteng has now overtaken the Western Cape with a recorded number of people who have tested positive for COVID-19. Public health facilities are struggling to keep up with the demand. Health experts have warned of the serious challenges ahead to provide proper health care for citizens in the upcoming weeks. So if public health is already under strain, what are the other options that are available? We find out how private hospitals are gearing up for the increased demand expected in Gauteng. We also discuss how these rising numbers are likely to impact on medical aid schemes. To talk more about this, we have Craig Comrie, the CEO of ProfMed. Craig, thank you so much for talking to us this afternoon. Let's just begin here. How are the private hospitals preparing for the surge in numbers?
Thank you, Bungi. I think what we've seen is certainly the occupancy rates of the private hospitals increasing, but we have regular updates from the hospitals that they have in fact still got quite a bit of capacity. So there have been lots of reports that they're almost full, but the private hospitals continue to indicate that the occupancy levels are probably sitting at around 50 to 70%, and that really is dependent on which area you're looking at.
And let's talk about, obviously the preparation period and looking at how the public healthcare system is, complaining that now, crying out to say that it is starting to feel the pinch and things are not looking so good. What conversations are taking place behind closed doors to try and ensure that the private healthcare sector does come in to assist the public sector here?
Yeah, we've seen a number of engagements with the public sector, and so there are some contracts between some of the large private hospital groups and the public sector to take over what they term an overflow of patients. And so there are a lot of beds available still to take in public sector patients where necessary.
And let's look at another issue. Of course, around this time, a lot of people may have exhausted their medical aid, funds to be able to have day-to-day access to doctors. What happens for your members that find themselves in that particular point right now and do need maybe, a quick visit to the doctor or even hospitalization, because sometimes it does not even treat other, conditions?
It's a really important question to answer, and the first thing is to please engage your doctor, and we're encouraging members to use digital platforms and telemedicine to initially engage your doctor in terms of the right way of then getting the treatment that you need. And so we have seen in the last probably 3 to 4 weeks that the number of consultations that doctors are having and the number of members that they've seen has increased from the very low levels that we've seen in April and May. So the first thing is to make sure that you aren't using unnecessary, you aren't clogging the system unnecessarily. And so please I think everybody needs to assess themselves, and then we're encouraging the telemedicine route in terms of getting your initial consultation. And that way we can alleviate the amount of testing or the amount of unnecessary testing that we've seen happening in the current situations. Certainly testing is exceptionally important, but that should be reserved for those who are experiencing mild to medium symptoms in terms of COVID-19.
And when you look at the medical aid plans themselves, because you do have plans that are comprehensive and can cover everybody and can cover every single ailment, then you do have other plans that have some kind of limitations. And with medical aids, they were not prepared for a situation like the outbreak of this particular pandemic. How have you seen, your members being, handling this particular time, and also your scheme? How has it been assisting even in those plans that have some limitations?
Certainly at the start of COVID-19, there was lots of uncertainty about access to treatment, but the regulator and the Council for Medical Schemes has actually stepped in quite quickly and indicated that COVID-19, the testing and the treatment, becomes a prescribed minimum benefit. And so these PMBs require every scheme to cover the testing where there's been a proper assessment and referral from a provider or a healthcare provider. So we can assure the members of schemes, regardless of whether they feel their day-to-day balances have been exceeded or their savings accounts are now depleted, the PMB legislation provides the assurance that schemes are now required to pay for your treatment, and whether it be testing or in-hospital treatment.
And have there been any challenges with paying out in some instances?
Yeah, at the moment, I think we're waiting for the next 3 weeks to be the absolute surge in terms of the amount of claims that we actually start seeing coming through. At the moment, for many of the medical schemes, this has been a reasonably controlled and small amount of people heading to hospital. But the last week probably shows more than double the 3 months before during lockdowns. So the last week has actually certainly increased the amount of testing and the amount of hospital admissions that we've seen.
And I know you say that there are some discussions that, have been taking place behind closed doors. Let's look at this practical example for, just here. If someone goes to a public health facility, they're not able to find a bed because, of course, capacities may have been reached at that point. Could it then be as easy as a phone call from that particular hospital to a private institution to say, can you please assist us with this patient?
Certainly, there's a joint operations unit that is coordinating that referral, or what they are calling it is the diversion of patients from hospitals that are overcapacitated at the moment to other facilities, whether it be the new field hospitals that are coming up and coming on stream quite quickly, or whether it be to another private facilities where the state has contracts with those private hospitals. That is being coordinated through that process.
And is the diversion only in a case of maximum capacity, or are you also looking at other underlying conditions where you see that a patient is not, getting the medical treatment that they should be getting in a public institution?
Yeah, at the moment, I understand that engagement is around the COVID-19 treatment of patients. Certainly in the private sector, there are certain hospitals that don't offer all the specialities, and so where they might have an overflow of orthopedic patients, they are already diverting those type of emergency cases to other hospitals with a correct level of skills and specialists available.
And Craig, I know that the public healthcare system is complaining and even saying that they're concerned around capacity. Is the private sector also worried that, as of course you extend yourselves and having these particular conversations, you might also be running out of space?
It's something that we're going to monitor over the next few weeks, and I think the key thing for us is to actually see where COVID-19 infections and hospital admissions then actually peak. And so whether that's in the next 2 to 3 weeks, that's our estimate at the moment. Certainly we have assurances from all the hospital groups that our members can still access their facilities at this point in time. But that does change quite quickly, so it does mean that we need to monitor it almost daily to see what the occupancy levels are. And the next 2 or 3 weeks are going to tell us exactly how we cope with the peak.